Across the Queen City, inside executive boardrooms and high-tech startups. From research impacting the future of how we do business, to providing critical infrastructure to keep business moving and to keep workers safe. For more than 50 years, Business Niners have been at the forefront as doers, bold leaders, and change agents, driving business in Charlotte and beyond.
Welcome to the CEO Speaker Series. I am Jennifer Troyer, Dean of the Belk College of Business at UNC Charlotte. I'd like to welcome all of you who are joining us today for this signature event, and most of all, a special shout out to our students. If you'd like to share information about this event on social media, the hashtag is #CEO Speaker, and the handle is @UNCC Belk College. The CEO Speaker Series provides an opportunity for Belk College students to hear directly from business leaders. Over our history, the Belk College is proud to have dozens of CEOs and C-suite alumni placed in Charlotte and across the world. Over the past 6 years of the CEO Speaker Series, we've been honored to have many distinguished speakers for this event, including Robert Niblock, the CEO of Lowe's, former CEO of Lowe's, Kelly King, CEO and Chairman of Truist Financial, and Susan DeVore, CEO of Premier. As we celebrate the 50th anniversary of the establishment of the College of Business, it's fitting that we welcome one of our own distinguished alumni today, Chris Peak. Chris Peak is the president and CEO of CaroMont Health. CaroMont Health is the largest employer in Gaston County and a major economic driver for our region. Chris joined CaroMont Health in 2017 and quickly sought to reinforce the 75-year-old health system's role as regional healthcare partner with deep roots in the community it serves. Chris has worked to align operational, medical, and clinical leadership in support of a model of healthcare that prioritizes compassion, accountability, reliability, excellence, and safety. In 2018, CaroMont Health was named one of the nation's 100 top hospitals by IBM Watson Health. The system has also earned more Leapfrog Group Grade A ratings for patient safety than any other hospital in the region. Prior to joining CaroMont Health, Chris was the Deputy County Manager for Mecklenburg County, overseeing a $1.6 billion annual budget and operations of 5,500 employees. A 30-year resident of Gaston County, Chris is an honors graduate who earned his Bachelor of Science in Business Administration from the Belk College. He also holds an MBA from Amberton University. Chris also serves on several nonprofit boards and serves on the board of directors for the North Carolina Healthcare Association. Chris, welcome to the CEO Speaker Series. First, I will be asking you some questions, many of which were submitted by our students. And then a little later, I'll introduce a few of our students who will be asking their own questions today. So let me just start us off with a few questions about CaroMont. So what is your role as president and CEO of CaroMont Health?
Well, Dr. Troy, thank you so much for having me here today. This is a true pleasure and just truly exciting to be back in the Belk College. And we'll talk a little bit about my experience there, but CaroMont Health is just a wonderful place to be. And to be able to serve as the president and CEO allows me to set the course and direction, both strategic and operationally, for the largest independent hospital system in the state. And so as CEO and president, you have a lot of opportunity to shape how we reach patients, which is truly why we exist. It is a not-for-profit hospital, but as all good business students know, in the not-for-profit environment, you have to have some measure of margin, and you have to operate just as leanly as for-profits if you want to fulfill your mission. And so CaroMont Health is, as you said earlier, the largest employer in Gaston County with about 4,300 employees. And we have about 50 outpatient practices, 435 beds at our main campus. And a couple of years ago, we announced building a second hospital and medical campus in Belmont, which is just slightly west of Mecklenburg, there on the campus of Belmont Abbey College. So really excited about the expansion and the growth that's happening.
Oh, that's great. That's great. Well, a lot has changed over this past year. When did it hit you that the pandemic was going to be a big challenge for our community?
We were very fortunate in that our senior leadership team began discussing this the December prior. And so in January of 2020, I actually issued a directive for readiness with regard to preparations that would be necessary to address what we would anticipate would be the effects of the pandemic. Now, quite candidly, I'm not sure any of us anticipated exactly what it ended up being. The roller coaster ride that we were on with regard to March, matter of fact, I think today is actually a pivotal point when a lot of states actually began to take action, very decisive action on how they would attempt to avoid what we saw happen later in the summer. And so that preparation was really starting, the key to that was starting to open very effective lines of communication across the organization about what was happening, the importance of people knowing what I knew and what others knew in senior leadership in real time. And so that was some of the infrastructure that we built with regard to the pandemic. With regard to the response to that, obviously that has been an ongoing challenge as it has taken numerous twists and turns. But I'm certainly delighted to be talking with you today in a state whereby we are certainly moving toward what I believe will be the end of this pandemic, and then we'll have the opportunity to learn some more about how we prepare for an event such as this in the future that hopefully never comes.
Right. Agreed. Hopefully never. So I just want to ask you a question about your mission. So your mission is to provide compassionate, exceptional, and highly reliable care. Was your ability to do that been impacted at all by the pandemic?
Well, that's fascinating, and that's a great question. And I will tell you, as a leader, mission and vision to me matters. Oftentimes, those are just words and exercises you go through as an organization, and you sort of put those in an annual report or in a book on the shelf. Not long after I came and joined CaroMont, we explored our mission and vision and actually repositioned it to what you just recited. Our mission a number of years ago was incredibly long and laborious, and was about national recognition and all of these aspirational things. And we really simplified it to say, what are we really about? What gets us up in the morning? And it really is about providing, first of all, compassionate care in a way that's exceptional. And high reliability is something, as you know, that comes from the airline industry and the nuclear industry, whereby we are highly reliable in that we do not cause harm, or we do not have failures, and we create a culture that prevents those failures before they happen. And so that became our focus. And as a result of that, we felt like we'll get the recognition if we earn it by delivering that. And matter of fact, it's relatively new, just a few days old. Caramot was actually named the number 3 hospital in the state of North Carolina, behind UNC and Duke. And so that's pretty exciting for a small independent hospital to outscore on outcomes a number of other very, very good hospital systems across the state. So I think the pandemic just kind of exposed how our strength around continuing to keep those things in focus. And I will tell you, Dr. Troy, we actually used that, our vision, which is to be our most trusted healthcare partner in the community. We actually were able to use that vision as we were saying yes and no to things that we would do and that we would provide with our partners. So we found that very beneficial be able to refer to that and rely on that for decision making, not just as a rallying cry for the organization.
Yeah, I mean, I couldn't agree. I think that understanding your mission and living your mission is really, what it's all about. I mean, so kudos to you all.
Thank you.
So in a recent interview, you talked about a culture of excellence. So since becoming CEO, what sort of steps have you taken to foster that culture?
Great question. I'd probably break that down a little bit in that, first of all, you have to have a common understanding of both of those key words in that. What is culture and what is excellence? Culture, at least in our world, is the world I've tried to create. It's the way we conduct our business. It's the way we live. It's sort of the written and the unwritten rules by how we do what we do, why we do what we do. I had the county manager, previous county manager in Mecklenburg, used to say, culture is about what you're doing if your mom was watching. That's how that's how culture should be. It's how you behave. So there are rules of behavior in addition to how do we define excellence? Well, excellence for us is sort of wrapped up in patient outcomes. Is that how well did we take care of patients? Obviously, there is certainly care that is provided at all stages of life. There are oftentimes procedural interventions that result in extending life, and then there are times when we are in stages of end of life. But excellence can be delivered in each of those. So part of it is having that common understanding of what rules are we going to create as a community, as a society, to hold ourselves accountable to around what is excellence for us. And that is wrapped up in our patient experience and our patient outcomes pretty simply. And those are things that we can measure. And so those measurements become a part of how we do our daily business. And I'll give you an example. We utilize a strong, deliberate huddle system. So most units start the morning with a very structured 5 to 7 minute huddle. And they are reviewing what the performance results were from the previous day, what any safety issues, patient safety issues might have arisen and that might need to be addressed, and what's the work plan or the flow for today as to how we're going to meet those targets. So it gives that very quick, very brief check-in, but it refers to, okay, are we living our values? Let's remind ourselves of that, how we're approaching this day. And then what are our measures of excellence and how are we going to hold ourselves accountable to that? Because we know tomorrow morning we're going to be talking about it again. So it's about creating that culture of expecting that tomorrow morning we're going to have conversations about, did we deliver excellence the day before? And based on the way that we defined it. And if not, do we either need to redefine it or do we need to reinforce the cultural components that will lead us to that excellent outcome?
Excellent. So I just mentioned, that I'd learned a little bit about that from a recent article. I think we've got a picture of the cover to show our students. So this is, the latest Business North Carolina magazine. So, congratulations. So this really helps me segue into our next question. And that's really about what's next. So, what's on the horizon?
Oh, that's a great question. This is, as in most businesses, if you're not growing, then you're probably losing size and share and ability to reach. I'm truly motivated because I believe what we do matters, and I believe that at CaroMont, and I'm sure other leaders are going to tell you the same. At our location, I believe that we can deliver something special to the families and to the patients that trust us with their care. It's really fascinating. I will tell you, as far as transitioning into the healthcare space, I started scaring people a little bit with my business background, in that I was referring to patients as customers, because in the healthcare arena, they're referred to as patients. They're not, physicians would occasionally attempt to correct me to say they're not customers, they're patients. And I would respectfully offer them the question, well, did they choose to come see you, or were they forced to by some other means? And of course, the answer is they chose to come see that particular provider because there are other providers in this region, particularly some wonderful providers in multiple healthcare systems. I said, well, since they have a choice, then they are in fact and indeed a customer. And therefore we should understand why they choose to come to you. And as we look to grow as a system, I mentioned the second campus there at the campus of Belmont Abbey. We'll see that. We've now expanded into 5 different counties with outpatient practices. And I foresee that growth to continue because I think we have a special product that we're bringing to market, and that we're going to continue to do that because as you know, your background is incredible from a health and human services. The access to care is such a barrier to some of our health outcomes, particularly for historically marginalized populations. They've been underserved because they have not had access, whether it be transportation, whether it be economics, a number of factors. I feel like we have an obligation to attempt to bring that care to them to the degree possible. That's part of our mission. That is part of providing compassionate, exceptional, and highly reliable care, is creating that access to that care. So that is part of our, without laying our strategic plan totally in front of the world, that is, we are certainly growth-minded, as well as maintaining the quality that we're very gracious to have been recognized for.
It makes a lot of sense. So can you talk to us a little bit about your path to your role as president and CEO?
Absolutely. I probably have the most non-traditional path to this job, and I will tell people that ask, I have yet to fill out an application for this particular role. I was, and this is probably a life lesson if we're talking about life lessons for students as they're pursuing their aspirations in business. I actually came into this role through volunteer work on a board, and actually never asked to be considered for this particular role, but was recognized by other members of the board that said, the leadership that you're bringing in a volunteer role is the kind of leadership that we believe could be very effective in leading our organization. And quite candidly, Dr. Troyer, when the search committee for the CEO position approached me, I laughed at them. I was like, "This, you do realize I'm in local government leadership, not in medical leadership." And they're like, "Chris, we're not asking you to do surgery. We're asking you to lead an organization, and you demonstrated the ability to do that in your career. And so it's just a matter of understanding how those principles apply in this different sector." And so the pathway, and I guess that would be the guidance that I would give to each student as they're looking forward to graduation and pursuing their career, is really find your passion around what you love doing, and do whatever you're given with the absolute best of your ability. And then the appropriate doors will open for you. The opportunities will open for you. What I see, and I see it now even in our workplace, some of our highest performing talent at directors and senior director levels, I watch some of them, and I see them pining for that next move and not really enjoying where they are right now. And so if I could encourage our student body to really enjoy every phase you're in, soak all of that in, do the absolute best work you can do at everything you do, and then allow those opportunities to present themselves as you make yourself available and demonstrate your ability to lead where you are, not just where you want to be.
That's great. I think that, I think that students all feel like they need a plan, right?
Right.
And there is a need for planning.
Of course.
You need to plan your way through your degree program and plan, to get the professional development. that you need in order to be successful in your first career related job, and then so on. But it is true, I think, that many of the folks that I've talked to find that opportunities open to them that they never imagined. I know it happened to me. So
yeah, absolutely, exactly.
right.
So enjoy the journey. Just
That's
not,
right.
don't
That's
get so focused on the destination that you think you want to go to, because sadly, oftentimes when you get there, you will find that maybe it wasn't quite what you thought it would be.
Sure.
And if you take the time to enjoy the journey and really explore that very deliberately, and you sort of follow your passion, and the last piece of it I would give, I know we're strapped for time, but just a little nugget, find an organization, if you can, that you believe in what they believe in. I know we talk about that in business school, we talk about the alignment, but it's so important to be a part of a culture of an organization that aligns with your personal values and your beliefs, because you will just be so much more fulfilled and more effective in what you do if you do that.
Yeah. Absolutely. So what is your favorite thing about your job?
Oh, I have so many. This is the thing. And every CEO is different, and I work with a lot of them, and there are a lot that have very personal expectations, and I quite candidly I pride myself in being fairly low maintenance, because I see this role as serving 4,300 people and over 1 million patients, not 4,300 people serving me, so to speak. So I think it's that fulfillment of every single day when I wake up, the work that I get to do today is going to have a direct impact on the lives of some family in this community. What better? What more motivation can you have? I mean, I'm going to make a decision today that has a direct impact on someone, and hopefully in a positive way. Hopefully I get more right than I get wrong. And then ideally I get to plan the future, and set some things in motion that may actually change this community for the better. I've had the opportunity. Education is something I truly value. I believe it's a gateway to those opportunities that we talked about earlier, to the effect that a couple of years ago, I went to our school superintendent here in Gaston County, and I asked him about starting a health sciences academy. And so now at East Gaston High School in Mount Holly, we have an elective CaroMont Health Sciences Academy. And those students started, it's completely voluntary. Students from around the county can join. It's free, it costs them nothing. And they can graduate they go there from 9th to 12th, and they will graduate with one of 7 certifications, one being a CNA 2. So they can actually come out of high school with a certification that would typically take another year and a half to earn, and then be able to transition, if they want, into nursing, either at UNC Charlotte or Gaston College, or the new nursing program started over at Belmont Abbey that they started in conjunction with us as well. So yeah, you get me a little excited when we talk about what excites me. Those things excite me, because somebody's life is going to be different because of the opportunities of this position and the way I'm able to use that, hopefully for the greater good.
Understood. It's interesting to hear you give an example of really partnering with other entities in the region to raise all boats, if you will. And, I think that's, I think that's an admirable thing, but I'm just sort of curious about, why this is sort of personally important to you to be partnering with others in Gaston County.
Well, that's a great question. And some of it's history. This is pretty much home for me, in that it's spent over 30 years of my life here. Moved here when I was 10 years old. And I think we're the largest employer in Gaston County. We likely have a lot of influence of what happens here. And I almost think it would be irresponsible for us to not create opportunities for collaboration with other organizations, because hopefully it makes us better and makes them better, but at the same point, it makes our community better, which is all part of good corporate responsibility. And I don't care if you're for-profit or not-for-profit, corporate goodwill, corporate responsibility is a real thing, but it only happens if the people that are leading those organizations take it seriously and do it. And it doesn't matter if you're in for-profit or not-for-profit. I truly believe you have a responsibility as a leader to create those connections to make us all better as a society, regardless of what business or what industry you're serving in.
I agree. All right, so let's pivot to some questions about you and your journey.
Sure.
So, there are many dimensions of success. How do you measure success?
That's a great question. It's success for me is that it's pretty simple, is that I can feel that I have made a difference in the life of somebody else. I know that sounds a little too altruistic maybe for some, but that truly is success. Listen, if we live in a world that's just all about us, which oftentimes on the national spectrum, we kind of see that modeled, unfortunately. And unfortunately, those stories are perpetuated both on social media, national media, across the board. If we lose sight of the fact that there's something out there besides what's in it for me, then I think we're in danger as a society of really devolving into something we won't be very happy with. So defining success for me, it's really interesting. You may find this sort of thing that you didn't know about me fascinating. I have never worked in a for-profit environment. I have, since the very beginning, since leaving Belk College. Actually, my first job out of Belk College was teaching high school and I taught calculus and algebra and business. And then from there went into business and HR, which HR was my focus at Belk College. And then it kind of evolved from there. It wasn't that I was concerned with being in for-profit. It was just for me personally, making a difference matters. So defining success for me is that someone is better because of something that I did.
That's great. So, what are you most passionate about? Maybe give us 2 or 3 things that you're most passionate about.
Sure. These are probably maybe a little more cliched. I'm never ashamed to say a big part of who I am is faith-based, and I'm proud of that. It has shaped me, and that's important. I'm very passionate about living that, because the tenets of my faith are centered around how we treat other people and how we make a difference in other people. And so that's important to me. I'm very passionate about that. Very passionate about my family, and that's very important. Wife and 2 girls, and I have a dog named Fenway, which is probably my 3rd passion, which are the Boston Red Sox and big Red Sox. sorry, Yankee fans that are on the call. I love the Red Sox, love baseball, and I'm passionate about the work that I do. I really do get to do some amazing work and some fun work and work around some great people. And so those are things that really light me up, and it's really easy to talk about those things that I have passion about.
Sure, I can see that. So, who or what has really shaped you as a person?
Well, I have been really fortunate to have some amazing influencers in my life. I'll tell you, my history is not probably the same as some. I was born into a family in severe poverty. We lived, there were times when I was an only child. My dad was a Vietnam veteran, and at that particular time, when he returned from Vietnam, they did not receive the welcoming that many veterans duly and appropriately receive now. So there were times when, as a small child, I ate the last meal in the house, and which has truly shaped me. And maybe some of the things that you just heard about passion and importance and mission, I haven't forgotten that. because I think that's important to understand that there are many people right now in that same condition that my family found itself in. And so one of the bigger influencers was certainly my parents, who were in that environment. And now my dad has 2 doctoral degrees. And my mother's deceased, but she went on to earn multiple college degrees herself. So they gave me the inspiration. And my dad always told me, if someone else can do it, son, you can do it. You may have to work a little harder. It may not come as easy for you, but if someone else can do it and you really want to do it and make a difference, then you can do it. And he demonstrated that to me over the course of his lifetime. And thankfully, he's still with me, and we still talk quite frequently. So he's a big influence in my life.
That's a blessing.
Absolutely.
All right, so I'm going to take you back in time a little bit. So this one is we dug up this photo back from your graduation in 1993, when you were a student, or just graduated student.
Yes, that's right.
Pursuing your BSBA. So can you tell us, what are 3 things you wish you'd known then?
Wow. Well, other than knowing to buy into the IPOs on Amazon, Apple, Facebook, and Netflix, then that would probably be one thing I'd like to know. There's a lot of things, I think. Well, you can see, and honestly, I still love that picture, even though I was kind of rocking the 90s mustache. That smile was, I was really, really thrilled with the accomplishment of graduating from Belk College. That was no small deal. It was hard work, and I was very proud of that. And luckily, that the photographer, which you get one picture, that was it. And so I was kind of like, that kind of captured the moment for me. I was really happy and really proud. My family was very proud for me. There were some things that I wish I had known. When you're in the grind of the Belk College, you do tend to just, I just can't wait to get through this, rather than just trying to soak in every moment of every hard assignment, every difficult professor, and really trying to understand and appreciate that. I don't know that while you're in the midst of it, you fully appreciate the full scope of learning. And we were talking earlier about, group projects. Those are just, I recall in my senior year, one of our capstone projects was a group project. There were 3 of us in the group. We come to make the presentation. It's probably a 30 or 40-minute presentation. And one of the team members just didn't show up, just bolted. And so, the other team member and myself, we adapted, we adjusted on the fly, because we were not notified and had no idea that the individual was not coming. And I don't know that I fully appreciated, what I learned from that, which was not that this was a presentation on whatever the business case was that we were arguing, but the real learning was, we learned how to innovate and adapt and be resilient because of that particular assignment. And so I think if I were, able to share that with folks of what I wish I had known, I wish I had known to look past just the technical part of the work that I'm having to deliver, and really try to learn from the interpersonal dynamics and the emotional intelligence skills that I was learning, and probably didn't even realize that I was learning in the process. So I think I wish I had known to be a bit more conscious of that, so I could learn in that. And if I were instructing the class today, I would certainly be challenging them to say, it's, yes, you need to understand the business logic and the analytics that support your business case, but I also want you to learn about the people that you're around and understand how to interact with them and the importance of that. Because when you become leaders, it's as much about emotional intelligence of how you inspire and create performance as it is about the analytics that you're going to need to understand and evaluate to make good decisions. But you can make good decisions all day. If you can't motivate people to act out or to carry out and execute the strategic plans or the tactical supported plans that you have, if you can't motivate them to do that, then there's a high likelihood of failure rather than success.
That's great. I mean, I think that, the group projects are tough. I mean, they were tough when I was an undergraduate, and they're tough. They're tough for students now. I think, we have this sort of added dimension of the pandemic now that where, clearly interaction between individuals is it's somewhat different. And so, I think it's how to sort of inspire people to rally around and be their best selves in those sorts of settings is something our students are certainly having to manage through.
Absolutely. I'm sure they're doing well.
So you mentioned group projects. Are there other ways that the Belk College helped prepare you for where you are now?
There were many ways. Don't diminish the technical skill that you learn. Those accounting courses that you're saying you're not an accounting major and you really don't want to understand that, you're going to need to understand that, even if it's not how you spend your day every day. Well, and if you may say you may not need it, you're going to want to understand that. You're going to want to understand the financial health of the organization that you're participating or that you're giving yourself to, because you're going to work a lot of hours. That's the one thing in any leadership position that many of you will find yourself in. The hours it's going to be work, and there's going to be a lot of hours, and that's why I say love what you're doing, because you're going to spend a lot of time doing it. But Belk College gives you a good foundation, and that's the one thing I appreciated is I received good exposure to marketing, to accounting, to finance, to all of those various things. And of course, my focus was in HR. I felt very well-rounded coming out, and so don't underestimate the value of that as students, because that is great value that can add to your portfolio as you find the area of interest that you're going to focus in. Don't devalue those things that you feel like you just have to do to finish your degree plan. Really take advantage of that learning, because you're going to find it valuable later.
Understood. Great advice, Chris. All right, so now I'd like you to meet a few of our students. They're going to ask you questions. These questions have actually been submitted by students from the Belk College. And Lakeisha, could you get us started?
Sure, thank you. Hi, Mr. Peak. My name is Lakeisha Rios, and I am currently a student in the Master in Management program, and originally from Queens, New York. And my question pertains to recruiting and retaining staff. How do you assess professional development opportunities for your current staff to address disparities within healthcare?
Well, that's a great question, Lakeisha. And disparities in healthcare, we mentioned a bit earlier, are very real and very prevalent in this country. So with regard to professional development, we use a lot of data analytics, first of all, as a foundation. So we really understand, particularly because it varies from community to community. In New York, you're going to see different disparities maybe than you would see in Gaston County. And quite candidly, we see different disparities in Gaston County than we do even in Mecklenburg County. And so we use our EMR, our electronic medical record. We have Epic, which is the brand of the system, and it has a subset called Healthy Planet. We use that to actually do projections and predictions on what those disparities are in the community. In other words, what are we seeing? Because quite candidly, you can't have quality healthcare with inequities in healthcare. It's just not possible. It is not quality. It is a problem. Matter of fact, as part of the North Carolina Hospital Association, we spent about a full day on this about 3 weeks ago, talking about the inequities that currently exist and the biases that actually exist in our healthcare system, and what can we do as a healthcare association to try to address those. So from a professional development perspective with our staff, first of all, it's informing them so they understand what the current state is, right? And so we understand what the future state should be, because the future state should not have adverse impact on any given group. with regard to disease outcomes. But we have some dramatic differences right now in the way certain populations are affected by disease, COVID being one of them. And a lot of that is related to, again, the things we mentioned earlier with regard to access to care, which is why it's really important to me to create that, or eliminate those barriers to access. So from professional development, it is about constant education based on the data that is relevant to solving the problem, and then continuing that pathway of growth and learning from a population health perspective, which we have a staff in-house that is dedicated just to population health and how we approach our community to try to eliminate those disparities. And the last thing I would share with that is that there's constant communication and collaboration with our public health department partners, as well as our FQHCs, which are federally qualified healthcare centers that are supported by the federal government to reach into historically marginalized populations.
Thank you.
Thank you, Chris.
You're welcome. Great question.
All right, so we have our second student, Taylor Quinn.
Hi, Ms. Peak. My name is Taylor Quinn, and I'm a sophomore economics major from Pittsburgh, Pennsylvania. My question is, what would you say is the #1 challenge for growth plans in 2021?
Great question, Taylor, and go Steelers. The big challenge, I think, for 2021 is human behavior over the last 12 months has been changed. We all behave a little differently than we did pre-pandemic. So the question will be, which of those changes will be carried forward and will be sustained by the communities rather than those that will revert back? In other words, consumer behavior, from a business perspective, consumer behavior, is it permanently altered, temporarily altered, or partially permanent and temporarily altered? And I think from a growth plan perspective, and just speaking from healthcare, is we're not sure what kind of patient interaction that we're going to see going forward. I will tell you, our emergency department is usually about the 3rd or 4th busiest in the state of North Carolina. Now that sounds crazy. We had over 130,000 emergency department visits year prior to pandemic. That's a lot of visits for a community that only has 220,000 people in it. We have seen about a 65 to 70% reduction in emergency department visits during COVID. So we're not sure whether or not that's a permanent change whereby people have decided to seek care in different ways, which is honestly what we want them to do, because they need to be connected to primary care, because a lot of what you see in an emergency department are things that are not at the acuity level that need to be seen there. And so we need them to be seeing care in a primary care or in other outpatient settings rather than in a very expensive inpatient emergency department. So I think unpredictable consumer behavior is probably the biggest challenge, at least that I see, going into post-pandemic 2021.
Thank you so much.
You're welcome. Great question.
Hi, Mr. Peak. I'm Russ Cherry, and I'm a student in the Master's Management program as well from Rock Hill, South Carolina. And as someone who's interested in a career in healthcare leadership and transitioning from the clinical side of medicine, through your journey professionally, what prepared you most for your CEO post?
Oh, that's a great question, Russ. And we do still wear ties occasionally, so that's a very nice touch there. I think it's a culmination of things, Russ. I would say the blend of clinical and administrative is going to serve you very, very well as you pursue, because you will understand. That was one of the things as far as the learning curve for me. I had to spend a lot of time with clinical folks, but not because I had to as CEO, because I could make decisions based off the data that's in front of me, but because I wanted to. I wanted to understand what they go through every day. I wanted to understand what it's like to be on a patient floor when you have 4 angry patients all pulling at you, wanting you to do something different all at the same time. And so I spent a lot of time in scrubs as a non-clinical individual, just observing and trying to be able to empathize with that. So to be a successful leader in healthcare, I think you're off to the right start of really trying to understand the pressures that are on the clinical side, but you'll have to also dig into the administrative pressures and challenges associated with the way that healthcare is paid for in this country, which is a whole nother hour's worth of conversation. But there's a lot of pressure between those two because in our healthcare system, we the patients are not really the payers. It's the insurers that are the payers, and that is a very different consumer than what you as a patient might choose. So as you look into healthcare, the more I would say become as well-rounded as you can be, and then find that area within the healthcare system that you really enjoy, and then let things happen from there.
Thank you.
You're welcome, Russ.
Hi, Mr. Peak. I'm Destiny Fagar, a freshman business honors program student from Mount Holly, North Carolina. My question is, given recent supply chain challenges highlighted by the COVID-19 pandemic, what long-term impacts do you expect within your organization and how companies' supply chains are managed?
That's a great question, Destiny. And the supply chain collapsed early April of last year, pretty much across the board. It's very fascinating, as I was talking to a CEO yesterday that is actually in the PPE business, and some of the observations that they are making now post that of what happened overseas, and how some of the GPO, the General Purchasing Organization contracting, may have been in conflict with the supply chain. So there's some things there that we have to learn from a governance perspective in the country to keep oversight on that type of thing. So everything's not just sold to the highest bidder all the time. The adjustments we made, I can probably sum it up in 3 words with regard to supply chain, and that's diversify, diversify, and diversify. We were, I would say, inappropriately complacent with our GPO supply chain. And what we found ourselves having to do is to go outside of that chain very rapidly. And as a result, the costs to us as an organization were very, very significant. And those costs to a country actually have been very, very significant. So I think we will be very cognizant of our supply chain and whether or not we even choose to start owning some of that, rather than just being totally dependent, particularly on imported product.
Thank you.
You are welcome.
It's a fascinating problem.
It is.
And I agree with you. I think we need a whole nother hour to talk about how our healthcare system is financed, governed. It's as somebody who's done research in health economics, it's near and dear to my heart, but it's more time. We probably need to wrap up today. So I just want to thank all our students. Thank you for those of you who sent in questions. And of course, thank you, Chris, for the time and the fantastic insights today.
Oh, thank you. It was my pleasure.
So Chris, do you have any sort of final thoughts to sort of wrap up the discussion for our students?
That's a great question. And guys, hopefully I've shared something with you that mattered and that's meaningful. And I'll end with a little 30-second example that kind of resonates with me. A few years ago, I had missed breakfast and lunch and was in the afternoon and found myself standing in front of a vending machine. Just don't tell anyone. Put my money in, press the button, and as many of you have experienced, the thing turns, but nothing drops, right? And so pressing the button, nothing's happening. Press the change return button, nothing happens. And so I do the only logical thing that you would do next, which is put one hand on each side and my foot in the middle and tried to shake the machine. Finding that that was no success, I went to leave. And as I put my head down to leave, I saw a little piece of paper laying on the floor up under the machine, and I pulled it out. And of course, you know what the paper said. It said out of order. And as I walked back to my desk, it kind of dawned on me that when things are out of order, you'll never get your change. And for life in general, if you keep things in order, if you keep your values, your priorities, your passions, all of those things in order, you'll get the change and the opportunity that you want to see and that you aspire for today. So thank you very much for letting me be a part of this today. Very proud of the school, very proud of Belk College, very proud to be a Niner. So thank you, Dean Troyer.
Thank you, Chris. We're very proud of you. So I have a few final announcements, notes for the students. I wanted to share with you a few upcoming events that we have for the college. So please join us on the 17th for our entrepreneurial decision series. We're partnering with the College of Arts and Architecture this year to talk about art and design in the marketplace. And we have an alum that will be speaking at that particular series on the 17th. We also have a couple more upcoming conversations that I'd ask you to take a look at and think about attending. You can learn more about our upcoming events at belkcollege.uncc.edu/50events. And then one more slide for you. We are interested in your feedback. So if you could, please help us as we plan future Belk College virtual events by scanning this QR code and providing us with feedback. Everybody who fills out the survey will be entered to win a Belk College gift pack. So this concludes our program today. Please stay safe and well.